Hi everyone, this is Dr. Greeshma, consultant ENT surgeon and allergy specialist. Do you get a blocked nose, sneezing, itchy eyes or wheezing when seasons change, during pollen months or when dust builds up at home? Tablets help for a few hours, but there is a way to train the body for long-term control. It is called allergy immunotherapy. There are two main options, allergy shots and sublingual immunotherapy. Most allergy medicines reduce symptoms. Immunotherapy works on the cause. It teaches your immune system to react less to common allergens like house dust mite, pollen such as parthenium, mold during monsoon, cockroach and pet dander. Over time, many people need fewer medicines. Benefits can last even after finishing the course. First, allergy shots. These are tiny injections with a small amount of your allergens. You start with weekly injections for about 3 to 6 months. This is the build-up phase. Then you take one injection every 3 to 4 weeks. This is maintenance. Total duration is usually 3 to 5 years. Because a serious reaction is rare but possible, shots are given in the clinic. You wait about 30 minutes after each injection. Sublingual means under the tongue. You place a tablet or drop under your tongue every day. The first dose is in the clinic. After that, you take it at home. In the beginning, mild mouth itching or tingling can happen. It usually settles. Availability of drops depends on your city and your doctor's plan. Both methods can work well. Shots have very broad evidence and can be customized for many allergens. Slit is convenient, needle-free and usually has a good safety profile. The best choice is the one you can continue for full course. Safety comes first. Start only when asthma is well controlled. Tell your doctor about all your medicines, especially heart and BP medicines, like beta blockers. For slit, people with a condition called eosinophilic esophagitis usually avoid it. Your first slit dose is supervised. Shots are always supervised with emergency care available. Hate needles or long travel and traffic, slit may suit you. Prefer a monthly clinic routine instead of a daily habit, shots may suit you. Shots are often easier to tailor. Slit can be child-friendly. Costs vary by city, clinic, time and product. Ask for the total 3-year cost, not only the monthly cost. Plan for adherence. Some people feel improvement in a few months. Best results build over 1 to 2 years. For long-term benefit, plan 3 to 5 years. It is a drop under the tongue. If you want control beyond daily tablets, consider immunotherapy. Choose the plan you can complete. I wish you easy breathing at home, at work, and during festival seasons. Thank you. Please subscribe to my channel to keep yourself updated about advances in ENT treatment.